Did you know a newborn baby can be infected with over 25 sexually transmitted diseases before it takes its first breath? The Body, 2010, Web. Before I started research, I had no idea, but I found the 4 most common STDs that women sometimes have to face during pregnancy. A woman not only has to worry about her health, but her baby's health too. There is also a possibility that the mother could have a stillbirth. An STD can be passed from a pregnant woman to her baby before, during, or after the baby's birth. The 4 most common STDs are chlamydia, gonorrhea, genital herpes, and HIV. This topic could relate to women that have an STD and is pregnant now, so they might be scared that their child might catch the disease when it is born. Or maybe you're a woman wanting to start a family and you have an STD and you're scared of the outcome if you get pregnant. I would like to take a few minutes to inform you about the effects are on babies if the mother has an STD. I'm going to focus on the 4 most common STDs. The most common STD is chlamydia. The mother might experience frequent urination, pain during intercourse, vaginal discharge, or irregular menstrual cycle. Women's Health, 2010, Web. The mother is tested at her first visit at the gynecologist. If the test comes back positive, she can be treated with azithromycin or amoxicillin to help from spreading to the baby. If they take these antibiotics every day for 7 days, it will cure 90% of infected mothers. It is important for the mother to get tested 3 weeks after the woman's treatment just to make sure the body is rid of the disease. If the baby contacts chlamydia during the pregnancy, it is possible that he or she will develop infection in his genital, lungs, ears, and eyes if the baby becomes infected. They may also develop pink eye or pneumonia. Pregnancy Info, 2009, Web. The second most common STD is gonorrhea. Most women experience vaginal discharge, burning or pain during urination, spotting, and pain during intercourse. With gonorrhea, it is not tested for, but the mother can ask for it. The gynecologist will take a swab of her cervical fluids. If the test comes back positive, then she will be treated with antibiotics. If it is left untreated, the baby can be born blind or with joint or blood infection. Live Strong, 2010, Web. Women with gonorrhea have a higher rate to have a miscarriage because women develop pelvic inflammatory disease. Gonorrhea can cause septic arthritis, meningitis, and pneumonia if the baby is infected. Antibiotic eye ointments are given right after birth to prevent gonorrhea from spreading into the eyes and possibly causing the baby to go blind. Baby Center, 1997, Web. HIV is tested 2 ways. One test is called CD4 test and the other is called viral load test. The CD4 test tells the doctor how much HIV has weakened her immune system, and the viral load test tells how much HIV is in the woman's blood. If the test comes back positive, the woman should use short-term triple antiretroviral therapy. After the baby is born, it should be treated with azithromycin for the first 6 weeks of its life. If the mother is healthy, HIV will not cross through the placenta. The baby will only be infected if HIV-infected blood or fluids are exposed to them. In any delivery, many women prefer to have a C-section just to make sure her baby is not infected. American Pregnancy, 2010, Web. 1 in 5 women are diagnosed with genital herpes. It is known as the most common STD in pregnant women. This is a disease that can be treated during pregnancy without infecting the baby. A blood test is done during the 20 to 24 weeks of pregnancy. However, herpes screening is usually not done during the routine doctor visits, so many patients ask for that part of the screening. If the doctor catches the herpes during the first trimester or the second trimester, it is very unlikely that the baby will be infected with that STD. If the woman becomes infected with herpes during the last trimester of her pregnancy, she is more likely to have complications during labor. The disease can infect the baby's eyes or cause a developmental retardation. When the baby is born, it might be premature. It is used to be tested for herpes within 24 to 48 hours of the baby's life. If the test results come back positive, intravenous treatment with azithromycin should begin right away. Pregnancy Info, 2009, Web. I feel like many people think that if a woman has an STD that she cannot have children, or they think that the baby will have the STD or cause stillbirth. It was a surprise to me that with any of the STDs that I have wrote about in my speech can be cured, it is not life-threatening, unless the mother does not get tested or is treated right away. Of course, no one wants to be diagnosed with chlamydia, gonorrhea, genital herpes, or HIV. But luckily, these diseases can be cured through antibiotics and not cause many difficulties with a woman's pregnancy.